Hi everyone, and thanks for joining us today. I'm Emily, the Content Manager here at Birdie, and I will be your host for today's webinar session. Now, as you can see, I'm joined by Alice Green, and she is the Improvement Support Manager at Healthy London Partnerships, and I'll let her introduce herself in just a minute. But first, I just want to check that everyone can hear me okay. So if you could just pop a yes or an emoji, whatever you want, into the chat box. Just so I know you can hear me. Now, you're all on automatic mute, so if you say yes out loud, then I can't hear you. Great, cool. I can see a few people saying yes, that's all good. Now, Alice, can you just say hello too, just to make sure everyone can hear you as well?
Yep, hi everyone.
That's great, cool, okay. By the looks of it, everyone can hear us okay, but if you do have any sound issues, either now or later, just pop a note into that chat box and we'll try and help you out. I've got some of the team at Birdie who are on the chat, so they should be available to help you if you get stuck. Cool. Everyone's hearing me okay. I like the emojis too. Thanks, guys. So if you've joined me for a webinar session before, first of all, welcome back and thank you for coming back to join me again. And if you haven't, I'm just going to run through the format and what you can expect from today. Now, at Birdie, we're working on a number of initiatives to help the care industry, and these webinars that we're running are just one of them. I'll share some more of the stuff that we're doing in the follow-up email that I'll send to you after this webinar. But most importantly, the reason we're doing this is to build a collaborative network where we can all share our ideas, we can talk to each other, and we can work together, which is especially important while everyone is remote. So in this session, I do really urge you to ask all the questions that you have. Just pop them into the chat box. You can talk to each other in there as well. Just keep that dialogue going. And yeah, this is your opportunity to really kind of ask us anything that you want to know. So I do urge you to definitely do that. Now, today's webinar is about NHSMail, and to explain a little bit about why we're hosting this webinar today. A few weeks ago, we hosted a webinar with Claire Sutton from National Care Forum, and she let us know about the relaxed processes around NHSMail, which is a huge benefit for home care agencies. And since then, we know that thousands of home care agencies have signed up, and Alice and her co-workers at Healthy London Partnership have been leading the charge in London. But we were getting a few questions about how to get set up and what the process is, and really why home care agencies should be using this software when they already have an email software. What's the benefit here? So that's why we invited Alice along to join us today, so she can help you guys out and answer your questions and make sure that you can all get set up correctly and you can use NHSMail to the best benefit. So without further ado, I will let Alice introduce herself. So Alice, can you tell us a little bit about what it is that you do and a bit about you?
Okay, so hi everyone, I'm Alice. So I work for Healthy London Partnership, which basically is an organisation that tries to coordinate a lot of projects across London. So we work a lot with the SCPs and the CCGs, local authorities. So we were handed this project probably about over a year ago now, and it started off very much just for care homes, but we quickly realised that actually this was going to be incredibly useful for all care providers. So I have a team of 4 of us, and a lot of the work we do is not just to get care providers onto the system, but also to look at how we continue working with you to get that communication better between health and care. So this programme has had care providers input right from the very beginning. So in London, we did a 6-month discovery project where we had lots of care providers in a room, and we really broke down the processes you all have currently and how we could start rebuilding them in a simpler way once NHSMail is involved. So I'll go through a bit about how this project became more than just about an email later. But yeah, that's basically what we're tasked to do.
Perfect, thanks Alice, really useful. So first of all, I think the main question is, what is NHSMail?
Okay, so I'll share my screen. I've done a few slides. Let me just see if I can work this again. Oh, doesn't look like it's coming up.
guys, we're just trying to share the screen so we can really walk you through, as there's a few complexities that we should really get into. So just to make sure the best way. Let me see if I can get them.
Can you see if you can share it, Emma? It's not coming up as a tab for me.
Yeah, I'm just going to have a look.
Thank you.
Sorry guys, just
if I share my entire screen,
as always, it's fine. We're just proving that technology. It's fine.
If I share my entire screen and then put the PowerPoint up, it should probably come up, shouldn't it?
It should work. Yeah, I'm just trying to load it. So
Does that come up?
Yes, there we go. You can see it now.
Yeah. Okay, fab. So essentially, NHSMail is, at its very core, is just a secure email. So very much like all the emails you already use, but it makes sure that anything you send about the people you're caring for is completely secure. So you don't have to use any encryption. You can just send the information. What's really important to remember is that is only from an nhs.net to an nhs.net, or from an nhs.net to a gov.uk. So if you're sending any information to another Hotmail account from your nhs.net account, it will not, that's not secure. So at its core, that's what it is. Obviously, other general information sharing applies. So, only sharing what's absolutely necessary. But at its core, it's a secure email, which is completely free for you all to use. And it's just going to help you collaborate better with colleagues across health and social care. So I've just put a few screenshots there about just to show you what it will look like once you've logged in. So very, very similar to the emails you already use.
I think a really important thing that you just said there, Alice, is that it's secure if it's sent from an NHS email address to a gov.uk or another NHS email address, which is why the uptake of this is super, super important, because if people are transferring information between each other, then we need to make sure it's secure, which is why we should really push for all home care providers to be on this platform.
Exactly.
And just a note here from Claire in the chat box, Claire Sutton, who we did host the webinar with previously. So hello, Claire, thank you for joining us. Probably going to check that we're doing a good job, as she did mention NHSMail before. She said the latest figures are NHSMail uptake are 8,246 of a possible 15,000 care homes. So it's a really massive intake, and we have 23,631 new social care users through the fast track process, which is a massive success, really. And that's amazing to see that so many people will be using it.
Yeah, and I think it just shows that social care providers really understand the value of it very quickly. And I'll share some of the stories with you all later about how people are using it at the moment.
That'd be great, thank you. So really, what makes it different from regular emails? What is the kind of defining factor in NHSMail? So
essentially, it is that it's completely secure, and this programme started with the issue of fax machines being turned off, and thinking how, because a lot of social care providers were still using fax machines, how do we start to allow that secure communication flow and not stop and leave them with nothing to use? But it quickly became so much more than that. So what it's been allowing people to essentially do is change the conversation around information sharing between health and care. So a lot of care providers are saying they now feel like they're working in partnership with their health colleagues, rather than working kind of in isolation and not feeling like you're getting the same information as healthcare get. Using the same platforms really helping that. So a lot of information that previously care providers were saying they couldn't get because people had specifically said to them, you don't have an NHS email, or there's no secure way we can send that to you. It's now not being questioned. So a lot of the information is coming a lot quicker, and they're getting information they didn't before. There's also, you'll have access to a global address book, which has absolutely everyone who works, who has an NHS.net email address. so you'll have access to that, so you can really easily find colleagues across the sector and communicate in a different way. And I think that's key, really. It started off as just, oh, we're just implementing an email, but actually it's about changing conversations around how health and social care interact and communicate.
That's really interesting. I didn't realise that you had access to all of those contacts, and that's something that's definitely important for making sure that everyone's working together. So that's great, for sure. So at the minute, Alice, who is currently using NHSMail and who can use it?
So at the moment, so it's, NHS England, NHS Improvement, GPs are all on nhs.net, acute trusts, obviously care homes, dom care agencies. So there's, the whole population of health and care should be on that. Then you've got local authority who are all on gov.uk. So if you're constantly communicating with them, you can then communicate securely. So it's trying to get everyone across the sector on the same platform and able to communicate equally.
Amazing. So at the minute, how is NHSMail making a difference to care providers?
So I've put a few examples on here. We've done a lot of videos. We were about to do a video with home care providers actually just before COVID hit. So we're going to pick that up afterwards. So it would be great if any of you who start using it would want to be a part of that. It's really trying to share that knowledge about how people are using it and the impact it's having. And because you can get the email within 2 days, you can start to see changes immediately. So if we just take some of these, so a lot of these are care home specific, but we've talked to a lot of home care providers and they're seeing exactly the same benefits. So a lot around discharge summaries, so not getting them or them not being having the right information on them. So they've been able to call hospitals and then just get it emailed to them. Before they were saying they'd have to get the discharge summary sent in the back of a taxi, or they'd have to send that resident back to the hospital. So that's making that much more seamless. Again, the directory. So if you've got any new members of staff, being able to give them access to all the people they're going to need to speak to is really useful. And then being able to introduce yourself to them. Communicating securely, obviously that's, that is essential. And it means you don't have to worry about whether stuff's been encrypted. You can just send things across, and people from healthcare are very happy to share information over NHSMail. I think that's key feedback we've had, is that it's really unblocking those conversations. So one care home manager was saying, she has to really push to get some of the information on her residents, and actually since she's had an NHS.net, she hasn't had to have those conversations. It's just been sent straight across, which is great. It's reduced a lot of admin time for people. So specifically around bits of information that you don't necessarily need urgently, but you used to have to be on the phone to try and get through to the GP to ask for that information. They've been able to send that email across asking for that information, then can go and do something else while they wait for the reply, rather than having to stay on the phone. So when we were doing a lot of the research before this project, the amount of time care providers are spending on the phone was a huge one that people wanted to try and solve. So this has really helped with that. What else? I think the big message is feeling like, so the top lady you can see there, receiving information faster, she really wanted to explain that she felt she was now talking to a colleague rather than, working in isolation. You feel part of that network, that you're all working together for the care of, the person you're caring for, and you feel like you've got that support. People are using it for prescriptions, being able to send pictures. So someone I was speaking to was saying that they had they needed a podiatrist to come and look at a resident, but rather than having to wait for the referral, they could actually send pictures to the podiatrist, and they were able to suggest things over email just through those pictures being sent. So that cut out 6 weeks of toing and froing.
Yeah.
So loads and loads of benefits, and having an email trail of conversations, so you can go back through and check where things have gone wrong or where information hasn't quite got through, and it's just enabling that quicker communication really, to help improve the care for the people you're caring for.
That's great. I think what I'm really taking from that is the speed of communication is just massively increased with NHSMail. And also it's the credibility factor, like you said, having that NHSMail account means that, you're not withheld any information, you're part of the sort of inner circle of what you need, which is really, really good.
Yeah.
Definitely. Thanks for sharing those stories. I think they're really, really useful. So at the minute, we're obviously in the middle of a global pandemic. Everything is just crazy at the moment, but in terms of NHSMail, why should care providers be using it in light of COVID-19? How is it going to benefit them during this crisis?
So I think it's really 3 main things. So I think the ease and access to information is so vital at the moment, being able to get information about the people you're caring for quickly. So that is key. Being able to, which I'll talk to you about later, being able to have access to Teams, which having an NHSMail account is going to allow you to have access to. So access to Teams, being able to work remotely, virtually, being able to do MDTs. So I think having that virtual aspect is really important for everyone at this time. And just having the opportunity to speed up process for accessing this tool is huge. So I don't know if any of you tried to get onto an NHSMail before COVID hit, but it is a little bit more time consuming. So being able for you all to access it now, it's great because we've really cut down that process, as often happens in a time of panic. We actually focus and really cut it down to exactly what we need you to do. So it's much easier and quicker process for you to get on at the moment.
That's great. And really, really important to note that, if you've tried it before, it's definitely a slimmed down process now to make it faster. Yeah. As I mentioned Claire's comment, there's the fast track process, which has been really, really working. So if a care agency wants to use NHSMail, what's the first thing they need to do? Okay,
so this is the current process. Really, really, really simple. So all you have to do is complete a form for your organisation, which says details of your site and staff members who will need an email address. You then submit the form. So any providers that are in London will submit forms to my team, and then we'll just check them through, make sure that everything's there that needs to be, and that it's going to be accepted. And then we'll send straight onto an email there, care.registration, and then that will be set up within a couple of days. And then we've got, which I will go through later, access to loads and loads of support to help you get onto NHSMail and also how to start using it. So I'll just show you what the form looks like. So, as I said, really simple form. The bits in red just don't change. We created, I didn't create, but some very clever techie people created a robot who takes all this information, which has made it a lot quicker. So it's all been automated. So just don't change the bits in red. You then put in your social care site name. This forms part of your, so when you sign up, you'll get your individual accounts. You also get a shared email for the site. So if your site's Acorn Lodge, for example, you'd have care.london.acornlodge@nhs.net. So you will get your single ones and then your shared one. Whatever you put in the social care site name will be put into the shared mailbox name. So just make sure that that's what you'd want it to say. Name of town, you can either put your town name or you can put whatever borough you're in. So if you want to put Brent, Hounslow, Barnet, whatever you would like to put in that again, that's going to form part of your shared mailbox name. So if you want it to be London, then just put in London, and then it will say care.london. If it's Enfield, it'll say care.enfield. So just make sure that's how you would want your email to be shown. Your ODS code, most people don't know this, so you can either search via that ODS code link that I've put in there. If you're finding it difficult and you can't find it, just leave it blank and our team will fill that in for you. So don't let it put you off sending the form, just send it through blank and we'll do that for you. And then at the bottom is 2 people that you would like to give access to. The reason it's 2 at the moment is because we're onboarding so many people at the same time. We don't want to break the system, but you are allowed up to 10. So what we're doing is putting 2 through on this form, and then there's an email that you can send which can allow you to put an additional 8 people on. But I think to begin with, it's also quite useful to understand how you're going to use it within your organisation and who you think will best use it. And having 2 people set up will allow you to have time to think through that and then make sure the right people are set up. So if you're quite a large organisation and you still think 10 isn't going to be enough, just get in touch with us and we can talk that through, and we've approved other organisations to have more than 10 if we feel like that will really benefit them as an organisation. So don't let that restrict you. I think it's just working out who is best to have those email accounts to begin with.
For sure. Just to mention one thing on the form, Alice, just a comment in the chat box here. Where do we get the form from? I will be sending that after the webinar, so that'll be in your inboxes for you to fill out. But another thing, you said once the form's been filled out and they've sent it through, then your team will review it. And if they've got anything wrong, what happens then?
So we'll just get back in touch with you. The main things that people get wrong is, so where it says current personal email address, both those email addresses need to be different. So I know some people have got generic manager addresses and they've put that for both. They need to be different because that's where your personal nhs.net email address is going to be sent to. Mm-hmm. The other one is the mobile number. They can't be landlines. It needs to be a mobile number. And they both need to be different as well because that's where you're sent your password.
Okay.
Don't use the mobile number for anything else. It's only to send your password through to you.
Okay, really, really useful. Thanks, Alice, for that.
Yeah.
So the next question is there advice on who within the care agency will need an NHSMail account? Now, this sort of comes back to your initial point of there being 2 members of staff. So yeah, who really needs one of these?
So I think it's really up to you and how your organisation works. I would say really think about who are the people who are interacting the most with healthcare, local authority, and who would be most useful to be able to have that email address to talk with. What we would also suggest is where you've got that shared mailbox is trying to use that more so that you don't get people leaving and then having to have having important information sitting in personal accounts. So just think through, as you would with your emails you have now, just how you want to use it. I think people have often put kind of team leads at first, their managers, just so that they can kind of get an understanding on who it would be most useful to have. And it's really, really simple to add and remove people, and you can do that yourselves really easily. So don't worry too much about who you're putting. We just want to make sure that it doesn't provide another admin task for you, that is actually helping your organisation. So yeah, I would say whoever interacts most with healthcare.
Perfect. Thanks for clearing that up, Alice. There's just one question that's come in from Lucy here. What's the difference between owner and user? And can these roles be changed at a later stage if need be? How can this be done? Yeah,
so all that means is that you have the authority to add and remove people. So, it doesn't really matter because the help desk, which you would ask people to be added and removed, is care admin nhs.net. I'll add that to the slides and when we send them through, just so you've got that. They like everything to be asked through the shared mailbox you have, just so that they know that it's actually coming from who it says it's coming from. So don't worry too much about owner and member, but owner essentially can add and remove people, but you will both have access to the shared mailbox. So either of you would be able to ask care admin to add or remove people. And you can also swap those roles by emailing care admin as well.
Perfect, thanks. So it's mostly just done through that care admin, and then they can make the changes they need.
Yeah.
Cool. So the next question I have is, they've created the form, they've sent it through, everything's okay. What do they do afterwards? What happens next?
So this is about the relaxed rules, isn't it? So I wouldn't worry too much about this now. So because of COVID-19, so before COVID-19, every care provider who wanted to get an NHSMail account had to complete the DSPT, which is Data Security and Protection Toolkit. It's essentially an online assessment that just looks at your organisation's data security. There's 14 evidence points you have to complete. They're pretty simple. It's kind of a tick box exercise. So things like, do you have a list of your staff and all their roles? Do you have a data quality policy? And your staff understand their responsibility in terms of data protection? Just probably things that you've done millions of times. And part of what my team was doing before this was running workshops where we sat down with care providers and went through this with them, and they completed it at the time. And a lot of them actually said it was really useful for them to have somewhere that they could go, which showed that they were compliant.
Mm-hmm.
And the picture at the bottom is of our workbook, where we really simply cut it down and show you exactly what you need to do. But there's been a recognition that if completing the DSPT was going to prevent people from getting NHSMail, which is incredibly useful at the moment, that we kind of stop that DSPT and allow people to access NHSMail. So there will be, after COVID, there will be a lot of support to help you get through the DSPT. So it will need to be completed eventually. But there will be a lot of support around that. I think the main focus for now is getting onto an NHSMail and using it effectively. That's our main focus at the moment. But just so you're aware, eventually this will need to be completed, but it's really simple, and there'll be a lot of support for you as well to get through this.
Perfect. I think that support is really key. I think a lot of people might have been put off by having to complete that, but now we know that we can get straight in, there's less barriers, and then when it comes to it, there's going to be all the support on hand to make sure that that's completed. Now, just one quick question here that just came in while we were talking, and it kind of goes back to our point before. It says here, what if you are a one-person run, newly formed company in terms of the 2 account holders restrictions? So I'm assuming here it's just one person with a business. Can they still apply it as there's not 2 account holders?
Yeah, absolutely. So if you send that in the email, if you just put what you've put in that chat box, just said that you're a really, really small organisation that only needs to be one person on it, that's absolutely fine. We'll process that. The reason it's 2 is just to make sure that if one person's away, another person can still access. But that's absolutely fine. If you only need one, then that's fine. Just when you send that through, just if you could just put that in the email.
That's really, really useful. I think that might be the case for quite a few domiciliary care agencies. If they are quite small, there might only be one person.
Yeah,
really,
I would think, just make sure you think about the resilience, so that there isn't important information that's left if you're off. So just if you can add 2 people just for that resilience, but yeah, and we can put it through with just one if absolutely necessary.
Perfect. Thanks for covering that one. So next up, what else is available to care providers once they've signed up? So
as I mentioned earlier, Teams is the big other thing that you'll have access to. So being able to communicate with people virtually. So these are just a few things that people are using it for. So contacting colleagues in different wards, using group calls for daily chat. So I know some care providers, their managers are sometimes working from home, so then being able to still keep in touch with everyone that's still working on site. So MDT meetings, providers are starting to do them virtually. So it's just giving you a platform that you're able to do video conferencing really easily and simply. So that's a really, really, really great asset that is also available. And then, you know, NHSMail gives you ability to be added onto distribution lists. There'll be quite a few things that NHS staff get that will be available to care providers as well, now that everyone's kind of on the same system. But there's a lot, I'll come back to it a bit later. There's a lot of support around how to use Microsoft Teams, because I don't know if it was really new to our team a few weeks ago. So there's a lot of support available to help you use it really well.
Perfect. Really, really useful that's available too, especially if they don't have the Microsoft 365 or the Office 365 software. This then gives you the access you need without having to have that yourself. So really, really useful. So once they've signed up and they've got all their access, everything's sorted, if they get stuck or they need any help, where can they go? What do they do at this point?
So there is loads of support available. So I've split it up into kind of 3 areas. So these are the physical resources that are available. So we've got a training guide for NHSMail. So this is signing into NHSMail, and then it goes through loads of topics of simple things you may need to check. Obviously, a lot of it, a lot of people will be able to log on and just be able to use it straight away. But it's just kind of top tips for people who need a bit more support with it. So creating groups, changing your password, creating a signature. So all those things, it will go through really simply. So I can send that as well. And then we've got user-friendly training guides for Teams. So again, this is going through some key things that you can do on Teams just to get you started. So creating calls, creating groups, and then some quick tips. So they are physical training guides that we can send through. What we also have are our webinars and demonstrations. So we have a pre-recorded webinar for accessing NHSMail. I would advise any of you, as soon as you get your welcome letter and your NHSMail account and your password, is to go onto this pre-recorded webinar, because it talks you through what your welcome letter means, and then it shows you on the screen exactly what you need to do. So all the way from inputting your new email, your password, changing your password, accepting the user policy, just walks you through the whole thing. So by the time you get to the end of that webinar, which I think is about half an hour, I think it's about half an hour, you'll have logged in, you'll be able to use NHSMail. So that's a really, really good one. We then have live weekly drop-in sessions. So 2:30 Tuesday, Wednesdays and Fridays. We have a little drop-in session where people just drop in to ask any questions they've got. So if they've looked through the webinar and their account hasn't played ball and there are some questions they've got, you can just pop in 2:30. There's someone there on those days who will just answer any questions. So you could get loads of people joining or no one. So just pop in and ask your question. So that's really useful. And then we've also got a pre-recorded webinar for using Teams. So that again was run with Microsoft as well, actually, I think, and is a really, really good Q&A session about how to get started and what to use it for. So loads of support available. And then anyone in London, feel free to ask me or my team any questions. What I would advise is, before you go to care admin with any issues, just come to us, just so we can try and troubleshoot anything before, and then try and get that process as slick as possible. But yeah, definitely advise these webinars because they're really, really good at just kind of providing a visual map of how to get through it all. And then thirdly is if you aren't in London, these are all the contacts for all the NHSMail leads for every area. So if you just give them an email, they'll be able to help you as well. And that's our London email if you want to get in touch with us.
Perfect. Thank you for sharing those, Alice. So we will be sharing the slides and all the important links for you after this webinar, so you've got those right into your inbox. And yeah, just as Alice said, anyone outside of London, there's also contacts there for you, so you can get directly in touch with the people in your area. Now, just before I go to the final question, we have a question that's coming from Lucy that says, so are we saying we get our personal NHS email box for the 2 people and then a shared one?
Yeah, exactly. So those, you get 2 personal ones, and then both of you will have access to the shared mailbox. And you can use that how you like. But yeah, you'll have one for your organisation and then 2 separate ones. And then if you want to add an additional 8 people, when you email care admin, you just say, can you please also add to the shared mailbox? And they can all be added to that shared mailbox as well. So it could be somewhere where, especially if people are changing shifts and you haven't quite finished the conversation, that everyone can see what's happened and what's been said. So it's a really useful tool.
Lucy just says, we've signed up and I guess I need to figure out how to see the shared box. Is that something that's covered in the webinar?
Yeah, it is. And Lucy, if you want to email the one that's on the screen for London, we can help you find that as well and send some stuff through.
Perfect. We'll follow up, Lucy, and send you all those links as well, so you've got them. And also Claire just said, if people outside London have questions, they can contact the Digital Social Care Helpline, and I will share the information for that after this webinar. Now, just finally, just to wrap us up, because everything's been really, really useful, and I think, such good practical advice here. But is there anything else that they need to know when it comes to NHSMail?
Something that's covered in the webinar as well is if you use Outlook already, add your NHS email to your Outlook. It's the best way to make sure you keep using it and you keep looking at it, because it will just come up as another mailbox in your email already. And then once you've added your personal one, the shared one automatically appears. So it's the easiest way to get that shared mailbox open and using them all, because otherwise you have to open another tab for your NHS.net. So if you can, try and add it to the email software you already use. Secondly is, as soon as you get your NHS email, share it with your GPs that you interact with, hospital staff. Just make sure that everyone's aware that you're on NHSMail and they can communicate with you in that way.
Perfect. So if they have any questions, if they get stuck with making their personal email they're using currently attached to the NHSMail, can they get in touch with you and you can help them do that?
So have a look at that that first webinar, because it will show them how to do all of that. So I would say that's your first port of call. Any questions, if you go to the drop-in sessions, because that will have someone techie from Accenture or NHS Digital who will also be able to help. And then, absolutely get in touch with us as well.
Perfect. Let me just check if we have questions coming in, just so we can wrap up with any Q&A. Guys, if you have any other questions, please just pop them in the chat box now, and we'll do our best to kind of go through those in the next couple of minutes. And like we said, everything will be sent to you afterwards. Just one question here from Lucinda. Is the NHS email used to distribute up-to-date guidance, etc.?
Yeah, it definitely will be. So we'll be able, as I mentioned before, be able to add you to distribution lists for that kind of information. So yeah.
Perfect. So they'll be kept up to date just by having that NHS email, which is a great benefit. Now, perfect. Now, if anyone else has any questions, you just got a few seconds to get them in. If not, then I will wrap us up, and I will say a big thank you to Alice for joining us. That was really, really useful, and some really great questions there. So thanks to everyone who joined us for asking those questions. I think it really made it interactive, and I hope that it helped. Like I said, we'll be sharing all of those resources with you, and if you need any help, There's the helpline. There's also the email addresses that Alice put in the slides. So you'll have those directly to your inbox as soon as we wrap up here and I send that over to you. So a massive thank you everyone for joining us. And again, thank you to Alice. Any questions, do email them over. Now with that, I wish you a really nice and sunny, hopefully, extended weekend. And I do hope you'll all join me for our next webinar, which will be hosted next Friday at 1 p.m. as usual. Obviously today we're on Thursday at 1 p.m. because of the bank holiday. And we'll be talking all about how to manage your business finances next week. I'll send you a link to that in the follow-up email too. So with that, thank you, Alice, and thank you everyone for joining us. Have a great afternoon, and I hope to see you all soon.